In the first year, I talked about basic diving safety. In the second year, I spoke about real-life cases from my practice. And this year, I would like to talk about something very important. How do we continue diving comfortably for life? Many divers I know are always thinking about the next dive trip, but very few would think about how to protect their ears and sinuses so that they can continue diving safely for the next 10 to 20 years to come. So, as we get used to how to do the pointer, oh, and now it's black. Okay, for those who don't know me, hi, I'm Dr. B. I'm an ear, nose, throat specialist, which means I treat everything from ear infections to hearing loss to sinusitis. I'm also a certified EDTC medical examiner for divers, qualified to assess both recreational and commercial divers. I may be one of the very few ENT who hold both qualifications, so I find myself to be in a very unique position to bridge this gap between diving and ENT health. So a lot of divers spend a lot of money maintaining equipment and upgrading equipment to prevent problems when diving. But actually, I think I see some concerns about sound volume. Well, nothing. Okay, let's continue. But actually, a lot of diving problems occur in tiny anatomical spaces in our body. For example, we have the sinus opening right up at the corner there. These are tiny pathways that must equalize for pressure. And number two, we have the inner ear, which is responsible for our hearing and balance. And finally, the VIP eustachian tube, which is basically a pressure valve between the middle ear and also the nose. And finally, the middle ear, which is an air-filled space that transfers sound and balance. Now, when these areas are blocked by small swollen tissue, small blocked pathways, and repeated inflammation, then problems occur. Okay, right. So I would like to do a small interactive poll. What ENT issues have you pushed through before? For example, ear pain during descent, or difficult equalization. Yes, another one. Sinus pain or pressure. Another two. Dizziness or vertigo when you surface, but you still go for the next dive because you feel okay. And finally, blocked ears after diving. Never mind, tomorrow we'll clear, we continue. This is actually incredibly common among divers, not just beginners. Even experienced divers, dive instructors, and also free divers. The problem is that if you continue doing this, it causes more problem because ENT damage usually occurs cumulatively, not suddenly. Okay, this is probably the most important slide on my entire talk today. A lot of divers will find this very familiar. Okay, when they go on a dive, suddenly they have some problem, and then they have this push-through mentality. It will clear eventually, don't worry, I can continue. Or I already paid for this trip, how a few thousand ringgit, I cannot miss it, right? Or I don't want to hold the group back, suddenly we have to abort the dive, jialat, very shy. The problem is the ocean doesn't negotiate with inflammation. It doesn't care if you have traveled 12 hours to the dive site or you have paid a lot of money to come to this place, because your body will always win the argument. It's matter whether you listen to it early enough. Okay, I want to share a real life case of an instructor who slowly lost comfortable equalization. This is an experienced instructor, not a newbie. So like all dive pros, he continued diving when he started experiencing difficult equalization because stopping means affecting work and income. Initially it's manageable, then slowly recovery became slower, and then system persisted longer. Finally, diving became very unenjoyable and uncomfortable. So the problem is that many people think experienced divers are somehow immune from barrel trauma. This is not true, because experienced divers actually accumulate more stress because they dive more frequently and they also push through longer. So I would like to address the most common barrel trauma, which is middle ear barrel trauma, also known as ear squeeze. These occur when there is pressure imbalance between the space of the middle ear, the area in bright orange, and the external environment, which is the outer ear, due to failed equalization. Most of the time, symptoms of middle ear barotrauma is milder than you think. Many patients come to me not because they experience severe pain, but because they ignored the mild pain during descent, they ignored the ear fullness and the crackling noise they held, and that famous phrase, "It's okay, I'll continue, you clear later." But sometimes it doesn't clear. So warning signs include ear pain, blocked sensation, muffled hearing, and that water in the ear feeling. So I will tell patients, please heed the warning and stop diving if your equalization becomes very forceful and the pain increases with that and hearing changes occur. One question I get all the time is, how long should I wait before I see someone? General rule of thumb is the symptoms last for more than 1 or 2 days, there is bleeding, there's discharge, or the hearing change is very significant, please seek help. Okay, I would like everyone here to remember one sentence. Equalization is a skill, it's not a strength test. The best equalizers are not the strongest divers, they are the gentlest. The earlier you equalize, the easier it becomes. And the more forceful you are, the more problems you create. Okay, next we'll talk about sinus barotrauma, and also known as the sinus squeeze. This occurs when there's a pressure imbalance between the sinus cavity, the little orange squares around your face, and the external environment, which is your nose, due to blocked sinus ventilation. This is easily missed because the symptoms of sinus barotrauma can be quite vague. Many divers commonly ignore mild congestions, allergies, or a little flu to continue diving. And then when they come to me and tell me, "Doctor, I had nosebleed after I came on surface," or "I experienced facial pressure, forehead pain, some toothache when I was ascending," immediately sinus barotrauma comes into mind. So please stop diving if the pain worsens with that. Congestion is persistent and this keeps happening every time you dive. Please seek help if you notice that there is persistent blockage, thick nasal discharge, or even facial swelling. And of course, is it recurrent? So I like this slide very much because it reflects real life. Most of the divers are focused on temporary fixes. They want a pill, they want a spray, in fact they want a quick solution before they go on the boat, ta-da, settled. But actually good dive health is maintenance. If you spend time maintaining your gear and also your equipment so that they can last you longer, you need to work on your ENT health to ensure that it works well when you dive too. So we need to manage allergies, give enough time for recovery after injuries, and also seek early assessment if the problem is recurrent. Good dive health, again, is maintenance. Yeah? So I would like to talk a little bit about inner ear barotrauma. So it is a pressure-related injury affecting the hearing and balance structure of the inner ear. Now, the inner ear consists of these blue triple loops, which are your balancing organ, and this purple snail-like structure, which is your hearing organ. It is connected to the middle ear cavity via a very thin membrane that works a bit like an eardrum. So this pressure injury can happen when the extreme pressure difference between middle ear and inner ear, for example, during a very forceful equalization. Now this is actually rather rare, but potentially a very serious problem. So if ever a situation occurs where there is sudden hearing loss or hearing changes, vertigo or severe imbalance, and persistent nausea and vomiting after diving, this is not normal. Please stop diving immediately, and this is a situation where the diver should not casually monitor for a few more days and see how it goes. Seek help early. Okay, another very common problem, ear canal infection and diver's ear. This is a painful condition where the ear canal becomes inflamed and swollen due to infection. It can occur to many people who have frequent water exposure. The ear canal will become narrow with inflammation, and then eventually it will shed ear discharge consisting of wax, shredded skin, and pus. So a lot of patients ignore the symptoms of mild itchiness and mild discomfort and the water trapping sensation to continue diving. But the warning signs include ear pain, swelling, ear discharge, and ear block. So I will usually tell them, please stop diving if your ear becomes painful, swollen, and these water trapping symptoms become worse. And if the pain becomes very significant and there's swelling of your ear, fever or bloody discharge, then you need to seek help early, or else you can head back to your home ground and then look for treatment. So I would like to share another case, another real life case of a free diver who delayed treatment. Now this is a very common thing I notice among divers, the delayed treatment seeking behavior. We always hope that the symptoms will somehow go away on its own. Sometimes they do, but sometimes you're missing out the valuable treatment window period, especially if this is affecting your hearing, there's vertigo or imbalance, or there is ear ringing or persistent pressure. Sometimes I know divers are very tough, we are mentally very tough, but this toughness should not delay our need to seek treatment early. Seeking treatment early can potentially protect your ear, your hearing, your balance, and your future in diving. Okay, I don't want to make you guys paranoid, but these are a few symptoms that I would like divers to recognize that they are not simple post-dive discomfort. Number one, sudden hearing loss or hearing changes. Number two, vertigo. What is vertigo? It's a sensation of room spinning, you can't walk, you can't stand, you feel like the world is upside down. Bleeding, anywhere, bleeding is not normal, yeah? Severe pain to the point that you need to stop or cry, a blocked ear that's getting worse, or persistent imbalance after the room spinning sensation. All these symptoms warrant an early medical treatment. Please do not delay. Early assessment will protect long-term diving ability. Okay, this slide is probably showing something that is very hard for many divers, knowing when not to dive. Sometimes the best dive decision is not to dive. It's not because you are inexperienced, you are weak, you are lazy. It's because you are a mature diver who thinks long-term. Skipping one dive and resting can sometimes protect years of diving in the future. So, when not to dive is very important. Okay, this slide is probably what the whole talk is about. We are not trying to become divers that's going to be better tomorrow, stronger, more powerful, deeper. We are trying to be divers that can continue dive comfortably and safely for the next 10, 20 years like the Dive Expo has happened. So, these divers who can dive for very long are not doing anything dramatic or taking some special anti-aging medication. They just have better habits. For example, resting well before diving. Very basic, but somehow we tend to overdo our body. Number two, hydrate properly. I cannot emphasize how important is it for you to hydrate yourself before and after a dive. Number three, do manage allergies early if you do have some. It is not going to go away just because you allowed it. Number four, we say this many times, don't dive if you're sick. And equalize gently, very important, equalize gently. Resting after challenging dives is not being lazy, it's being smart. And finally, if you do have some problems with diving, seek assessment early. Okay, although we don't really like to admit it, our bodies change. Understanding how our body changes with age is critical for our longevity in diving. So, number one, equalization becomes less effortless. This is because tissue elasticity changes as we age. So we just need to be more deliberate and equalize earlier. Number two, recovery takes longer. We don't bounce back as quickly from fatigue or minor inflammation like we used to do before. So respecting this recovery time will prevent chronic inflammation. Number four, hearing changes will occur, and this is because we have a lifetime of noise and pressure that will subtly change the way our hearing becomes. So please don't ignore changes in hearing and say it's just because of old age. And number 5, actually our balance becomes less robust as we age. Our inner ear's balancing organ naturally becomes less sharp as we become older. So we should be extra cautious when you're on deck or underwater. Listen to your body. If you don't feel right, don't go diving. And finally, most people as we age will experience reduced cardiovascular reserve. Our heart and lungs will work a lot harder to manage stress and also the heavy gear. Your physical limits will be reached earlier. Listen to your body. So the takeaway is that I'm not asking you to quit diving. I just want you to be smarter than your younger self. Manage your allergies early, hydrate well, and know when to skip a dive when it's necessary. Okay, just like how we check our gears before a dive trip, our BCD, our mask, our fins, our regulators, our ears and sinuses deserve a check too. So I've compiled a quick self-checklist for divers. I want you to go through them in your head and answer honestly. If you say yes to several of these, your body may already be warning you. So this is what I'm trying to say today is very simple. Many divers stop diving not because they suddenly lost interest. Many stop because their small problems became chronic problems. And then suddenly diving becomes uncomfortable. Fortunately, many ENT-related health issues are manageable if recognized early. So don't ignore symptoms and don't normalize pain. And of course, please don't wait until your dive trip is already ruined before you seek help. Preventive care will ensure that you can continue diving safer and longer for many years to come. Right, so now that, thank you for sticking with me for so long. So what's your next step now? I will be at the Asunta booth A273 and 274 for this weekend with the Asunta Hospital team. We're providing free ear scope checks to examine your eardrum and also basic health screening for blood glucose, cholesterol, BP, and also body composition. So do drop by our booth and show us some love. And next, as part of my commitment to ENT health among divers, I've curated 2 diver screening packages for this event. I've tailored these packages specifically to scuba divers and free divers to assess their ear, nose, and lung health. These packages are now currently available at a heavily discounted price for limited time only. So do drop by our booth and have a chat and check them out. Thank you so much everyone for your time. And before I open the floor to questions, I would like to ask everyone to keep in touch and connect on social media. Please do follow me on Facebook and IG, ENT Dr. B. And yes, let's open the floor to questions.
Thank you, Dr. B. Okay, any questions from the floor? You can ask right now. Okay, we have about the 5 more minutes, or you can also drop by the Asunta booth, which is maybe somewhere in the middle of the hall 2 on your left, on your right if you're coming in, on the left if you're from the main stage area. Okay, any questions? All right, we have a question here.
Hi, good afternoon, Dr. B. So what if we take a few of the checklists? That means difficulty in equalizing, and every time you dive, you have that challenge. And the ears stay blocked after diving. So what should we do to be able to dive?
Okay, let me repeat what you just asked. You're trying to tell me that you have repeated issues with equalization during diving and you're wondering what you can do better. So as a diver yourself, you need to first assess if your technique is correct. As I mentioned before, equalization is a skill. Talk to your dive instructor or your senior dive pros and have them assess if your skill is correct. If you're already doing everything right and still you're having problems, then this is the right time to drop by my booth. Let me examine you and see if there's ways for us to identify the cause. Among Malaysians, a very common problem is allergies. When there's congestion, minor flu that doesn't give you any problem on surface, it becomes a major issue when it's challenged underwater due to pressure. So yeah, that's what I would recommend.
Is there any few techniques that you could share? Because like
There are many techniques we could share, but I think this is a very practical skill, which I would think talking to dive pros around the Dive Expo today would be better.
how about from your own experience?
From my own experience, drop by my booth, let's have a
Yeah,
chat
sure.
later.
Thank you.
Okay, any other questions? Maybe one final questions. All right, no questions?
Thank you very much
Okay.
for your time and see you again next year.